Every day we rely on our local law enforcement officers to keep us safe and protect us. And sometimes they find themselves in difficult and traumatic situations that can have a long-term impact if not addressed. The Cummings Foundation for Behavioral Health is committed to helping. Dr. Davena Longshore with the Cummings Foundation for Behavioral Health is joining us now. Thanks for being here.
Thank you for having me.
What do you hear from law enforcement?
I mean, from dealing with so many traumatic situations back to back, I'm hearing that officers are suffering from depression, anxiety, sleep issues, issues within their marriages, financial issues, and they just feel overall so disconnected from their community. In some more severe situations, we're hearing that they're suffering from suicidal ideation, which unfortunately, officers are more likely to die by suicide than they are to die in the line of duty, with us losing over 120 officers a year.
What does your organization do to help?
So I've developed a program based on my proprietary model that addresses many of the issues that I just spoke about. While I can't give you the details of that model, I'll be publishing it later on this year. And we're just happy at CFBH that we can be on the forefront of developing mental health and wellness programs that can positively impact law enforcement within the United States.
And I think it's got to be hopeful and helpful for these law enforcement officers to know that there is support out there,
Yes.
there are resources. What have you heard from people about how your programs have impacted them, even saved their lives?
I mean, generally, we're getting reports of weight loss, better sleep, just generally better mental health and physical health. I think one of the most touching situations for me was I received an email from an officer stating that he could not get life-saving medication that he needed because he was in such poor physical health. And after being a part of our program, he's now able to get this treatment.
Oh my gosh. I feel like this highlights the importance of prioritizing our health and our
Yes.
well-being, and not just law enforcement,
Yes.
but all of us, because our behavioral health impacts our mental health
Yes.
and our physical health.
Yes. So I feel like mental health has kind of been so taboo in our society. It seems like just something extra you should do, but yet people will go get a physical exam and go get physical checks. But what we don't realize is the human experience is a combination of the mind and the body interacting with each other. And because of that, if your mental health is suffering, your physical health will suffer, and vice versa. For example, those who deal with depression are at a higher risk of having a heart attack, diabetes, stroke, getting an infectious disease, and contracting cancer. People with severe mental health issues die 10 to 25 years before the average person in the population. So the two are intertwined with each other.
We have to take care of ourselves, and I think sometimes that can be hard to realize that we have to take that step. I can tell that this is something that you're really passionate about.
Yes.
What made you decide to dedicate your life to this?
So prior to my current position, I worked in a level 4 double max security prison as a critical incident responder. So it was my job to respond to crises in a population that society considers the worst, or those people with your more severe and violent convictions. Every day, I was unaware of my safety, whether or not I would even go home to my family, which is very similar to law enforcement. In addition, I do hold a PhD in clinical psychology with a specialization in military, criminal, and police psychology. So the combination of my experience and my education, I feel like gives me the empathy and understanding that I need for law enforcement, but also I'm aware of the tools that they need so that they can live better lives despite all the traumatic experiences that they have.
And you're continuing to develop programs. What can we do to expand these services?
So you can just contact us and we'll take it from there. Email is best. We can be emailed at info@cummingscfbh.org, or you can just visit our website to learn more about us.
Thank you so much for coming in.
Thank you so much for having me.
And once again, you can get more information on the Cummings Foundation for Behavioral Health and how it's making a difference and how you can help support its mission by going to cummingscfbh.org. Stay with us. We'll be right back.